A stroke occurs when a clot or a rupture forms within a blood vessel in the brain, which in turn deprives it out of oxygen. According to the Centers for Disease Control and Prevention, a stroke is the fifth leading cause of death in the United States, so it's important to address this health concern that affects many people. The Stroke Support Association is a nonprofit organization that serves stroke survivors and their family in Long Beach and its surrounding communities. Since it's a local nonprofit organization, their funding relies on donations. The Stroke Support Association started when a group of Long Beach healthcare professionals met at a conference and discussed the need for a stroke program for when patients are discharged from the hospital. Their mission is to empower stroke survivors and their families with resources to recover, reclaim, and rebuild their lives. Being informed is vital to helping the survivors understand the changes that occurred due to their stroke and to help reduce the chances of them having another stroke. Healthy People 2020 has objectives focused on heart disease and stroke. Healthy People 2020 is aiming to increase the cardiovascular health of the people living in the United States, and they are also aiming to increase the amount of people knowledgeable about the symptoms of a stroke and how to respond to this medical emergency. The Stroke Support Association relies on volunteers to help with their services. There are different volunteering opportunities, such as being a support group facilitator, a hospital visitor, a board of directors member, social media support, media marketing, website updates, event representative, and administrative support. The programs that they offer comprises of the stroke support groups, the hospital visitor program, stroke education workshops that are held throughout the year, which are open to the public, and the Special Needs Fund. This community-based organization markets their programs through contacting stroke survivors and their families by visiting them at Long Beach Memorial Medical Center and the St. Mary's Medical Center. Some of the strengths of this organization are that their support group program provides an atmosphere for individuals to be able to learn valuable information about their condition, and their website also provides an extensive list of online stroke resources that people can easily access. On the other hand, a weakness of this organization is that their support group meetings do not occur continuously throughout the year. 3 out of the 12 months do not have any meetings. One of their programs is the stroke support groups. One is for the stroke survivors, and the other is for family members or caregivers. The first meeting ever held was in November of 1980, and it has been ongoing to this day. It provides information about stroke and community resources to stroke survivors and their family. They learn about problem solving and coping skills. The support groups meet every Tuesday for 1 to 1.5 hours. However, they do not have any meetings in April, August, and December. These groups are led by trained facilitators, and attending it is free of charge. Due to California's stay-at-home orders, they currently have Zoom meetings instead of in-person meetings. According to the different anecdotes provided in the Stroke Support Association's website, it appears that stroke survivors who attended the support groups benefited from the social atmosphere and the information being provided. They were able to learn about different ways they can cope with life after a stroke. An individual who would like to work for this organization and their programs will need to be patient, caring, responsible, and have effective communication skills, because having these set of behaviors, attitudes, and skills would greatly benefit their interactions with stroke survivors and their family. In terms of cultural competence in this organization, they currently provide support groups in English, but if contacted, they can provide more information about other support groups that are conducted in Spanish. They also have professional support from the Community Hospital of Long Beach Memorial Medical Center, St. Mary's Medical Center, and Veterans Affairs Medical Center in Long Beach. Additionally, different pages of their website allows for people to change the font sizes of the information being displayed. This shows that they are trying to accommodate to the different needs of their audiences. The executive director of the Stroke Support Association is Christine Escalona, who has a master's in public health. The support group administrator is Elizabeth Hardiman, who has a Bachelor of Arts degree. The board officers consist of Gretchen Phillips, who is the president and has a master's degree in social work. Vice President is Angie West, who is also the Program Director in Neuroscience and Stroke in Long Beach Memorial. Secretary is Diana Wagner, who is a Master's of Science in Nursing. Treasurer is Lynn Finley, who has a Master of Arts in Science degree. And the coordinator of groups is Jane Klaus, who is a doctorate in psychology. The following shows the contact information about the Stroke Support Association. And thank you for watching.